Have you ever thought about a disease that could work in secret, slowly changing your body for years, maybe even a decade, without anyone noticing? Well, that's the reality of acromegaly. It's a rare disorder of excessive growth that, you guessed it, often hides in plain sight. Today, we're going to pull back the curtain on this really fascinating condition.
So it all starts with changes that are just so easy to brush off. I mean, just look at these two hands. On the left, a pretty typical hand. But on the right, that's a hand affected by acromegaly. That swelling, the enlargement, that didn't happen overnight. Nope, it just kind of crept in, year after year, almost impossible to notice.
And that really gets to the heart of it, right? What happens when your body's growth signal gets stuck in the on position, long after puberty and everything else is over? Well, the result is this quiet, gradual, and total transformation.
Okay, so let's get into this slow, silent transformation. It really is an unfolding mystery, and it means that the journey to getting a diagnosis is, well, it's a marathon, not a sprint. And that's all because the signs are just so subtle.
You know, what's so wild is how ordinary all these symptoms seem when you look at them one by one. Joint pain? Probably just arthritis. Snoring? Happens to lots of people. Your feet are getting bigger? You probably just think you're getting older. It's this slow pileup of seemingly random problems that makes this disease so incredibly hard to spot.
And this timeline, wow, it shows you the real challenge here. The average delay from when the first symptoms pop up to when someone actually gets a diagnosis is a staggering 5 to 6 years. And in some cases, it's taken as long as 14 years. I mean, can you imagine living with a progressive disease for over a decade and not even knowing what it is?
So what in the world is driving this nonstop growth? Well, the culprit is a tiny little gland at the base of your brain that has, for all intents and purposes, gone completely rogue.
And that gland is the pituitary. You can think of it as the body's master controller, the conductor of our entire hormonal orchestra. It regulates everything from your metabolism to, you guessed it, growth.
Now, in over 99% of acromegaly cases, the problem starts right here. It's a small, non-cancerous tumor. It's called an adenoma, and it forms right on the pituitary gland. You can actually see in this scan how it just disrupts the whole normal setup. So this tumor, it basically hijacks the gland and turns it into a rogue factory that is working 24/7. It completely ignores all the body's signals to slow down and just relentlessly pumps out massive amounts of one single really powerful hormone.
And that hormone, it's growth hormone, or GH. What you're looking at are the actual overactive cells from one of these tumors, just working overtime. This flood of GH then tells the liver to make another hormone called insulin-like growth factor 1, or IGF-1. And that is the chemical that directly drives all the tissue overgrowth we see all over the body. Now, this hormonal overload does way more than just change how a person looks. It launches a widespread, systemic attack on the entire body. It's literally a body under siege. And because growth hormone receptors are found in pretty much every organ, the consequences are severe and they are far-reaching. I mean, we're talking about everything from heart disease and sleep apnea to type 2 diabetes and even a higher risk for certain cancers. Basically, no part of the body is safe.
The heart, for instance, is put under an incredible amount of strain. It physically gets bigger and thicker. That's a condition called hypertrophic cardiomyopathy. This really messes with its ability to function, and it's one of the main reasons for the increased mortality we see with this disease. And it's not just the big internal organs. Even the skin is affected. All that constant growth stimulation leads to thickening, oiliness, and lots of these skin tags. It's just another one of those seemingly minor signs that's actually pointing to a much, much bigger problem. Now get this, because of that huge diagnostic delay we talked about, more than half of patients already have established cardiovascular disease by the time they're diagnosed. Just let that sink in. The damage has been quietly happening for years. So once a diagnosis is finally made, how do doctors shut down that hormonal factory? How do they start to get things back under control?
Well, the diagnosis follows a pretty clear path. It starts with a simple blood test for that IGF-1 hormone. If that comes back high, they do a glucose tolerance test. In a healthy person, drinking something really sugary would make their growth hormone levels drop. But in someone with acromegaly, the levels stay stubbornly high. And then, finally, an MRI pinpoints the exact location of the tumor.
And treatment isn't just one thing. It's a strategic, combined approach. The first and most common step is surgery to just get that tumor out of there. If that doesn't completely fix the problem, then doctors move on to medical therapies that can block the excess hormones.
And as a third-line option, there's radiotherapy. Getting those hormone levels back to normal is absolutely the main goal. But treatment is often just the beginning of a whole new chapter. What is life like after that rogue factory has finally been shut down? This quote from the Lancet really highlights the tough reality for a lot of patients. It says that while treatment can stop the disease in its tracks, it can't always undo the damage that's already been done. Things like skeletal changes, joint disease, even high blood pressure, they can be permanent, lifelong reminders of the disease.
So, we're left with this really perplexing question. If the signs are there, a bigger hand, a changing face, nagging joint pain, why is it so hard for us to connect the dots? It's a powerful reminder, I think, that sometimes the most profound changes are the ones that happen just too slowly for us to notice, until one day, finally, we do.